The Medical Minute, bringing you up-to-date medical knowledge for healthier living.
Good morning, everyone. It is 7:25 on your Monday. Time again for our Medical Minute. Today I'm joined by Dr. Mark Winton, an infectious disease specialist at Bozeman Deaconess. Thanks for coming in this morning.
You're welcome.
Today
Good morning.
Thank you. We're talking about skin and soft tissue infections. What do people need to know if they get a cut or start to notice something on their skin?
Well, these may be from very minor to very serious, and typically your skin infections heal up on their own with very little help, but anytime you get a cut or a scratch, if it starts progressing where it gets worse, where you start having fever and chills and that red area around the scratch or cut expands and you start feeling bad, start having nausea and headache, it can turn into something much more serious.
Okay, and so I imagine at that point you'd want to go in, see your doctor, and something it could turn into is cellulitis. Can you explain that?
Cellulitis is a skin infection, and they may be progressive, and a lot of times you just need an antibiotic to take care of it.
Okay.
Sometimes they get down below the skin and they're more serious, and you may require intravenous antibiotics to get rid of them.
Okay. What are some of the symptoms of cellulitis?
Well, mainly it's a reddening of the skin. Sometimes the skin gets thickened, and you can feel kind of a rough area, and sometimes it looks like an orange peel.
Okay.
That red area may also lead to swollen lymph nodes along the chain where the scratch is. You may get high fever, chills, nausea, headache.
Okay. How can cellulitis be protected or be prevented? What should people do if they do get a cut or something?
Well, if you do get cuts or scratches, wash them out with soap and water as quickly as you can. Sometimes Neosporin will help head them off, but be aware that if they're not healing like they should, then you need to see somebody.
Okay, and again, at what point should you start thinking about seeing a doctor?
When it's kind of going away after a couple of days and just not getting better for you.
Okay.
Certain people are at more risk, like diabetics or people that have weakened immune systems.
Okay, so always keep an eye out for your skin and soft tissue. All right, thank you, Dr. Mark Winton. That does it for today's Medical Minute. You can always catch more health news on our website at kbzk.com.